My name is Dr. Ivy Brennan. I'm a naturopathic doctor here in New York City. Today we're going to talk about anxiety, specifically how anxiety can lead to acne and breakouts. And in these really crazy times, a lot of us are feeling a lot more anxious and a lot more stressed. And if you're somebody who's already having difficulty with your skin, you might be noticing that you're having even more breakouts than ever. So let's first look at how does a pimple actually even form? So first, you have an increase in sebum production. This increase is due to androgens. Androgens are our male hormones, basically testosterone and its stronger form, dihydrotestosterone, also known as DHT. Yes, they're called male hormones, but they're found actually both in men and women. As the sebum increases, bacteria comes in through the pore, specifically the bacteria Propionic bacterium acne. As that bacteria is growing, the pores often closes up due to keratinization, and so the bacteria actually gets trapped inside. Our body does not like having bacteria in its skin, so it mounts an immune response to get rid of the bacteria. With that immune response comes inflammation, and it's the inflammation that causes the red, painful, angry pimples that are very characteristic of acne. So now that we have a little bit of an understanding of how a pimple forms, we can now explore what the connection is between anxiety and stress and breakouts. So when we're more anxious and more stressed, our body produces more cortisol coming from our adrenal glands. Our bodies always are producing cortisol, but in these times, our body is producing more. Not just from looking at our basic cortisol rhythm that we have throughout the day, but also these spikes whenever we're encountering something stressful or something that's making us anxious. Our body increases cortisol in response to another hormone, corticotropin releasing hormone, which comes from our pituitary gland. When that hormone is increased, our bodies actually produce more oil. It also signals our bodies to produce more adrenal androgens from our adrenal glands. Again, that's testosterone and dihydrotestosterone. When these two hormones are increased, our sebaceous glands, basically our oil glands, they undergo hyperplasia, and that's another reasons why they're producing so much more oil. Another big factor is during times of stress and anxiety, our body actually becomes more inflamed. It has more inflammation, and that's going to be problematic in two ways. Like again, when we were thinking about like the mean, ugly, red, painful acne, but also it weakens our skin barrier, making us more susceptible for bacterial invasion in general. And then the last big piece is during times of stress and anxiety, our immune system actually becomes weakened. And so if you think about like crazy times when you've been stressed at work and you're more likely to get a cold or flu, well, similarly, that weakening of the immune system actually impacts healing. And we're seeing during these times that you might actually have a decrease in healing by about 40%. So thinking about obstacles to clearing those lesions. There's also ways that stress and anxiety indirectly can cause more breakouts. I don't know if you're like me, but when I'm anxious and stressed, I have a little bit more difficulty falling asleep, mostly because it's still kind of almost related to cortisol, because with elevated cortisol, it is just in general harder to sleep. Well, if our sleep is poor, our skin healing is also going to be compromised, and that's another reason why you might be having more breakouts. Big factor is when we're stressed out, when we're anxious, we reach for chips and cookies. Some of us might choose to have a glass of wine or a beer to unwind. All of these can contribute to breakouts. Specifically looking at refined carbohydrates and sugars, you're going to be having insulin spikes. With increased insulin, your body's actually going to be producing more androgens. And if again, remember, the more androgens we have, the more sebum production and the more likely we're going to be getting breakouts. I know that you already know that right now we should not be touching our face. But some of us, that is our stress, anxious way of handling stressors is by touching our face. And it's not just from wanting to avoid infection, but also avoiding breakouts. We really want to not touch our face, because every time we're touching our face, we're bringing more bacteria in, and we're also just aggravating our skin, which can lead to more oil production. Another thing that some of us tend to do is we get in front of the mirror, we pop a pimple here, we're picking at our, inspecting and picking at our pores. Really want to just leave the face alone to prevent breakouts. Now this part, it might sound counterintuitive, but overuse of harsh cleansers, serums, toners, all can have a negative impact in our skin and basically putting us in this vicious cycle, because every time we use these products, we're aggravating the skin, we're causing the skin to actually want to produce more oil, and you perpetually are on this vicious cycle. Some acne treatments can be good temporarily, or using them very liberally, not using them all over your face, but just like specifically to that problem area, and you might actually be wanting to apply it less than you think. So what are some of the main things that we can do right now to ensure that we're gonna have clear skin? The first, definitely want to get some really good stress management techniques in place, whether you're wanting to explore more mindfulness practices, things like meditation, breath work. I really feel breath work is a really powerful tool. I've started doing an 8 a.m. what I call breathing circle, where I guide you through a breathing practice on Instagram, but you can also do journaling. If you are in therapy, we're in therapy, this might be a great time to make sure that you're maintaining that relationship with your therapist, whether, I guess, using Zoom, speaking with a friend. Exercise can be really helpful, but if you saw my video on the cortisol rhythm and sleep, you'll already know that high impact exercise actually increases cortisol. So that actually could make the problem worse, versus doing more low impact, more restorative type exercises actually lowers cortisol. Maintaining a healthy diet, and what does that look like? But really making sure that you're choosing foods that keep your blood sugar stable, to avoid those insulin spikes. So when you're preparing a meal, making sure you have a good source of protein, that carbohydrates are complex, meaning that they have at least 2 to 3 grams of fiber, lots of fresh fruits and vegetables, and healthy fats. Can't say this enough. Don't touch your face, just leave your face alone. And when you're thinking about your skincare routine, less is definitely more, and err on the side of gentle versus harsh. Again, that's Dr. Ivy Brannon. I'm a naturopathic doctor here in New York City, and hoping that these tips will give you clear skin, and hopefully I've also helped to lower some of your anxiety. Well, looking forward to seeing you again.